Good afternoon. Today is Tuesday, February 9th. I'm Jim Weatherup, Chairman of the Oswego County Legislature. Joining me today is Diane Oldenburg, Senior Public Health Educator for the County Health Department. This week, I'm happy to report that our case numbers continue to decline and we have seen a slight increase in vaccine supply in Oswego County. According to data we received yesterday from New York State, a total of 13,796 doses have been administered in Oswego County through the various authorized vaccinators. Of these, 11,073 are first doses. Of those, the County Health Department has administered 2,506 doses, including 2,297 first doses and 209 second doses. This week, many more first responders, teachers, and healthcare workers are scheduled to receive their second dose. According to the state's data, 9.39% of Oswego County residents have received their first COVID vaccination. This is slightly higher than the statewide average of 8.23%. The state continues to make more people eligible for the vaccine without having adequate vaccine supplies. County health departments across New York State are struggling to meet the needs of their assigned populations. We are 9 weeks into the vaccine rollout, and we are still providing first dose vaccine to people in the first two priority groups. As we start to see more vaccines from New York State, we will develop plans to vaccinate restaurant workers and others that the state designates as eligible. As I mentioned last week, the state dictates how to deliver the COVID-19 vaccine and who is eligible to receive it. According to the state, hospitals administer Phase 1A populations, local health departments are assigned to administer to Phase 1B essential workers, and pharmacies are assigned to administer vaccine to residents 65 and older. The Phase 1A population includes doctors, nurses, emergency medical services, and other medical personnel who are frontline healthcare workers. Phase 1B includes people defined as essential workers such as first responders, educators, and public-facing grocery store workers. Local pharmacies are charged with vaccinating those aged 65 and older. In Oswego County, these pharmacies include Kinney's in Oswego, Mexico, Fulton, and Pulaski, and Wayne Pharmacy in Oswego. These appointments are made through the pharmacy's websites. Those aged 65 and over may call the county office for the aging at 315-349-3484 for help navigating the internet and making appointments. The Oswego County Health Department still has not received enough vaccine to cover all the Phase 1B population who are eligible to receive it. The Health Department is seeing slightly increased vaccine supplies, but most of the additional vaccine was earmarked for a special population of vulnerable and disabled residents who meet the state criteria. We are seeing high demand for the COVID-19 vaccine in Oswego County, and we hope the vaccine supply will keep improving as the governor said it would. In the meantime, who haven't been vaccinated to reach out to the health department. Before we can expand to the other groups that the governor has identified, the health department needs to complete the Phase 1B population that wishes to be vaccinated. The governor has announced that people with certain pre-existing conditions will be able to make appointments at state-run mass vaccination sites starting Sunday, February 14th, with appointments beginning as early as Monday, February 15th, according to the governor. Diane will provide some more information about eligibility. People have asked if the county health department can visit homebound seniors and vaccinate them so they don't have to travel outside their homes. The current state guidance doesn't include this population. The New York State Department of Health is starting discussions around planning on how to vaccinate the eligible homebound population, and we will follow the state guidance. The health department continues to work with Pulaski Urgent Care to provide free COVID testing once a week in Oswego County. Testing was held today in Central Square. The next clinic will be announced in the news media and on the county website. Although case reports continue to decline, I'm sorry to say that we have now lost 86 members of our Oswego County community to COVID-19. On behalf of the Oswego County Legislature, I once again extend our sympathy to their families and loved ones. We must continue to be proactive about our preventative measures to protect ourselves and our loved ones. Diane?
Thank you, Mr. Chairman. This morning, the 7-day positivity rate was down to 2.2%. The county's 7-day accumulated case counts have decreased 47%, down from last Monday's 321 to 173 yesterday. This is wonderful news. As of this afternoon, we have a total of 239 active positive cases, a total of 139,195 total tests have been run. We have total cumulative positive cases, 5,979. Total negative results, 131,183. Total patients released from isolation, 5,654. Deaths reported by New York State Department of Health related to COVID, 86. Total quarantined or in mandatory isolation is 779. And the total number vaccinated by County Health Department staff, 2,506. As Chairman Weatherup mentioned, the governor has announced that people with certain pre-existing conditions will be able to make appointments at state-run mass vaccination sites beginning Sunday, February 14th. The closest site is in Syracuse. People need to go through the Am I Eligible website to make appointments, and people need to provide a doctor's letter or medical statement to prove their eligibility. This group includes adults with conditions that put them at increased risk if they were to get COVID-19. They include people with cancer, chronic kidney disease, pulmonary disease, asthma, pulmonary fibrosis, cystic fibrosis, intellectual and developmental disabilities including Down syndrome, heart conditions, coronary artery disease, high blood pressure, weakened immune system, obesity, pregnancy, sickle cell disease, diabetes, cerebrovascular disease, neurologic conditions, and liver disease. Again, currently this population can make appointments at the state-run mass vaccination clinics through the Am I Eligible website starting February 14th. There is much more information on this process on the state website at coronavirus.health.ny.gov. The decline in active cases and increased vaccinations, however welcome, do not mean that we can relax our preventive measures. We are still facing emerging coronavirus variants, relative vaccine shortage, and continued caution fatigue. The County Health Department will continue to increase testing, trace close contacts, and vaccinate as vaccine becomes available. The Health Department's COVID-19 hotline is open Monday through Friday from 8:30 a.m. to 4 p.m. and Saturdays from 9 a.m. to 1 p.m. It is closed on Sundays and holidays. The number to call is 315-349-3330. Thanks.
Thank you, Diane. We appreciate everyone's patience. Please realize that the Health Department is administering vaccines to eligible groups in the most efficient way possible. The supply of vaccine that we receive continues to be inconsistent, but there will be eventually enough for everyone. We don't want the lack of transportation to be a barrier for those who need to be tested or who are eligible to receive the vaccine, and Oswego County can now provide free transportation to people who need rides to testing and vaccination appointments. Transportation is available Monday through Friday between 6 a.m. and 7 p.m. Appointments for rides should be made in advance by calling 315-598-1514. Thank you for your patience and for doing your part to prevent the spread of COVID-19. Stay safe on the roads and continue to maintain safe behaviors, including hand washing, face masking, and social distancing.